And that's where that generational intelligence comes in, is understanding what each generation, what they're motivated by, what they value, because that differs from generation to generation. When you look at your young millennials and Gen Z, who they tend to get a bad rap. It's not that they're not loyal, it's that they require you to prove yourself. I think that's what's so incredible about this younger generation. They're very conscious of their mental health, and that's something that they value. And if an organization doesn't support them in the ways that they need, including their own professional development and giving them the tools and the resources up front that they need to do their job, they do not feel bad about leaving. That's a big difference I've noticed with, our baby boomer, Gen X, older millennial generation versus this younger group that's coming in.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals to improve care delivery through integrated design and technology innovation. My name is Keith Washington, and joining me is Elizabeth Jeans, founder of Jeans Strategic Consulting. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, well, you're in the right place. Let's explore together what's possible when we go beyond the blueprint.
Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible, Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode.
So today I'm joined by Elizabeth Jeans, founder of Jeans Strategic Consulting and a healthcare leader with more than 20 years of experience across nursing, leadership development, organizational strategy. Elizabeth brings a unique perspective that spans both frontline care and executive leadership, helping organizations better align how they design, lead, and support their workforce. Elizabeth's been a strong voice challenging how we think about staffing as a system design opportunity. So today we're going to just unpack what that means in practice. So Elizabeth, I'll just turn it over to you. So we've talked a little bit about empowering influencers, how to lead when you're not in charge. I guess, would you start talking about that, from these concepts of systems and organizational design and strategy?
Sure. Thanks for having me, Keith. So when I am focused on leadership development, I like to focus on it from the ground up. And that includes your influential leaders in healthcare, because honestly, they're the leaders. Even though they may not have the title, they are the ones in your workforce that are going to impact retention the most. So when you think, especially in healthcare and especially as it relates to nursing specifically, the person those new hires are really attached to at the very beginning are their preceptors, those that are training them. And oftentimes I find that they get missed in the shuffle because, again, they don't typically have that leadership title. And then organizations miss the opportunity to develop them into true leaders. I truly believe that leadership is an action. It is not a title. And again, those individuals that are supporting your students coming through your organizations and supporting those new hires coming through your organization, those individuals need to be developed as leaders instead of kind of thrown into the deep end with no floaties. And that's a lot of what my work has been focused on, is that leadership development of the influential work piece of your workforce.
So I guess, how does that work in terms of practice? Do you start with just specifically going after that particular topic, or do you start with maybe a broader strategic framework for the organization, maybe looking at culture, looking at teamwork, looking at alignment, other factors?
So to me, culture begets everything, right? So if you get the culture right in an organization, every bit of success will follow, and it's not that difficult, right? And one of the biggest impacts you can have on culture is developing those strong leaders within your units. And so when you talk about it in terms of alignment and how we introduce that into practice, it's making a game plan, a strategic game plan on how you're going to formally train and identify those leaders. So first off, I talk to many, formal leaders about looking at your organization and looking at your specific unit and the team that you lead to identify those natural leaders, right? Those that demonstrate those leadership qualities that are really foundational to your mission and your values at your organization. And then start having those conversations very early. What are your goals? What do you want to be when you grow up? Are you interested in leadership? Because many times when we assign these leaders a title, it's kind of a voluntold type situation from what I've gathered. And they may not necessarily feel that they've had the training or the tools necessary to do that very well or do it efficiently and be comfortable with that. And so it's identifying them early and starting them into those, involving them in those leadership classes so that they do feel that they have the tools to do that job.
So then when you're involved with the client, say, for example, are you the one actually trying to develop that yourself directly to the frontline worker? Or are you working with, say, a department or a higher level team to sort of look towards implementing these kinds of, say, practices in the organization? Or I guess, how do you engage at that level?
So I've done it a variety of ways. So I've gone into certain organizations as they've asked me to consult and done a complete broad assessment of what their organizational culture looks like, what their training plans look like. Do they have an evidence base? For example, if we're talking about preceptors, those frontline leaders, do they have a solid evidence-based preceptor program? And for those that don't, I do have a turnkey program that I offer and that I can implement very easily and kind of a train the trainer type approach or coach the trainer type approach. For those that have a solid preceptor program, I do look at that from an evidence-based lens to make sure, is this the most up-to-date information? For example, the literature shows that the Ulrich preceptor model is the most validated preceptor training model that we have in the framework that we have. So I look through their curriculum and look and kind of how they're developing their leaders to make sure that it is evidence-based and then provide my feedback at that time. Though for those that don't have that program in place or maybe have kind of a develop from scratch model that may not be evidence-based, that I do offer the curriculum that I have developed.
So I guess maybe explore some healthy tension where you're going to organization and say they have something, but you kind of look at it and you're like, no, this isn't really what I'm talking about. Like,
Yeah.
how do you approach that?
So it's just great communication, right? So meeting with those leaders or those decision makers to say, hey, this is what you have, and point out the pieces that are good, that are evidence-based. And then this is how we can improve upon this based on what the literature shows to be effective. So it's not pointing fingers, and it's not saying, what you have is wrong or what you have is not effective. It's showing them what they have that is great and then how we can better improve upon that for the adult learner experience. Many times I find that the organizations aren't malintentioned, right? They don't have the intent of providing a bad product or a bad training program. It's about that they don't know what they don't know. And if that's not their jam, if that's not something that they're interested in or have devoted a lot of time into researching, then what I have found to be the case is they're not at all feeling defensive. They're excited to have that knowledge and they're excited to have a product that actually works for them to develop their leaders.
So when you're going about this work, I guess, do you find is nursing a particularly good place to enter the organization as a sponsor, I guess, versus maybe other either clinical roles or operational roles?
So that tends to be where I'm invited from the most, because I do a lot of speaking when it comes to the nursing realm, right? I just got back from speaking at the AONL National Conference and have received a lot of consult requests based on what I talked about there, which was influencing leaders using generational intelligence. So that tends to be how I get in the door or why I'm asked into that organization. But I don't focus just on nursing. And that's one thing that I do make very clear. Most hospital systems focus so much of their resources on nursing because nursing typically is your largest piece of your workforce when it comes to a hospital system. But when you think about it, a preceptor program, when you look at the term preceptor, that applies to anybody that is coming into your workforce. And I think it's really important. And one thing that organizations have come to value from my perspective is that I want you to think about your pipelines, right? We talk about, nursing pipelines or clinical pipelines all the time. And most of the time they think about that as synonymous with nursing programs, right? Nursing schools being their only pipeline. But when you think about somebody that is coming to work in your dietary department, right? To work in the kitchen, or somebody that's coming to work in your environmental services department, right? To clean those rooms. And there are that bigger kind of scope, those entry level non-clinical roles. If you think about why did they pick this job in a hospital when they could go work at a great restaurant, making tons of tips, making much more in terms of salary than if they were working in the hospital, and a lot less stress. And so when I've talked to individuals in those entry level roles, their reason, their why is because I want to be in the hospital environment, but I don't know what I want to do eventually. And that is, when you think about the role of a preceptor, helping them find their why and what they want to be when they grow up is part of that job. It's one of the roles in that model. And so having those conversations early and allowing them to shadow, that's something that applies to all disciplines, not just the nurse preceptor. It's all preceptors. And so one of the common themes that I see when I do a, needs assessment or a broad net assessment of an organization is that when they are teaching nurse preceptors, they're teaching skills. It's like they're redoing their skills, and it's very skills heavy, or it's very unit specific or population specific. So the neonatal ICU, they are teaching them very neat, NICU specific tasks. When in fact, a preceptor program is just that. It's a leadership program that develops them and teaches them how to teach, right? We're not teaching skills. It's not specific to nursing, because how you teach, it's all based in adult learning theory, which we're not equipped to know that if you're not taught that, if you don't go into education or have that formal background. And so a preceptor program, a good, effective preceptor program should apply hospital-wide, system-wide, regardless of the role, and regardless if it's clinical or non-clinical. And that's one thing that as I go into these organizations and meet with them is, okay, I see that you've developed something and you have a plan kind of for your nurse preceptors, but I don't see that in other departments across your hospital. And that's something that you need, especially when you want to grow somebody from an entry-level non-clinical role into your clinical pipeline. Use what you have. I truly believe we don't have a nursing shortage. We have a design problem, and we're focused on the wrong thing, and we're kind of boxed in, when in fact, if we kind of open our eyes, take a step back, we can see that we have plenty of people to do the work. It's not necessarily a people or numbers issue. It's how are you utilizing your workforce? How are you developing your workforce? Because we can get those entry-level positions filled, but we have to take some time to grow our entry-level non-clinical people into those clinical leadership roles if that's what they truly want to do, or if that's what they want to be when they grow up.
So when you present it that way, which sounds like a really amazing approach. So what kind of pushback do you get? What kind of friction is there? I know you've talked a lot about multi-generational sort of leadership opportunities. Do you find that changes based on, like you're talking about the entry level? I'm assuming if you're talking about an entry level, you're probably talking about more of a young person. I guess how does, in some cases, that's maybe a follow-up question too. Are you seeing a lot of people that maybe have more purpose-driven ambitions coming into this industry because they see whatever they were doing before maybe didn't quite have the passion for it? Like once you're in it, you can't unsee it. You see the opportunity.
Yeah, I would say more so even since COVID, that people, we saw a huge mass exodus due to trauma after COVID in the clinical side. I've also seen, more older generations that are coming into those entry-level jobs based on their own life lived experiences. So let's say they were taking care of an aging parent or grandparent, and that affected them deeply, or they had that interaction with hospice or home health, and that is bringing them into the healthcare world. So I've seen it multiple ways. Obviously, we do see more of the younger generations going into those entry-level jobs. We also see them coming through actual clinical pipelines, like going to college, going to nursing school, coming in that way, physical therapist, speech therapist. So I would say it's a variety. It's very nuanced. As far as pushback goes, I would say finance is our biggest kind of pushback, which is, I mean, healthcare costs money, right? And so when you think from an education standpoint and being in education for as long as I have been, we are not considered a money making department, right? We do not, they oftentimes see this as an investment up front, but don't technically see that return on investment. And that's my role, is to go in there and say, and put the money, kind of lay out the finances, lay out the numbers and say, this is what you can save when it comes to retention and turnover. Yes, it's an
Right.
investment up front in education dollars, right? You're going to have to pay them. They're non-productive during that time. They're not making the organization money. We are taking them out of staffing so they can focus on that education. But when you look at the return on investment, when you have solid preceptor programs, we see up to a 50% reduction in turnover, especially in that first year, which is a huge metric that most organizations are looking at, is 90-day and 1-year retention, especially
Hmm.
in nursing. And so if we can save just 1 ICU nurse, 2 ICU nurses, right? 3 med-surg nurses, right there, that you've made that money, right? Because we are seeing those more tenured staff staying much longer and enjoying their job, especially those that want to go into leadership, because they see that the organization values them enough to put that money and invest into their future, invest into their education. And so that's something that they value very greatly. And again, it improves your culture overall, because happy coworkers make a happy environment, and then you have happy patients, right? And so it does all come full circle.
So I guess maybe talk about the systems today and how they were designed, and some of the challenges versus what they could be, say, through a redesign process. So I guess the impression a lot of us have in these organizations that it's such a grind and sort of a survival mentality, as opposed to an opportunity to join something that's really special that you're going to get a lot of reward from. And by, like, say, avoiding that churn, creating that retention, creating that, say, ladder of opportunity, like that, who wouldn't want to go work for that organization? So I guess, like, is it like that today? Or are you seeing, is that like a false, narrative that no, it's really, these organizations are very much more dynamic than you might expect?
Some are, and some are
Okay.
still trying to get there, right? And it
Okay.
all depends on who you have at the top, right? And that's where that generational intelligence comes in, is understanding what each generation, what they're motivated by, what they value, because that differs from generation to generation. And so what you will find is some of the older generations kind of are very inflexible in their thinking about the workforce. They've done it this way for this long, and that's the only way they know how to do it. Others I've seen are much more flexible. And so they're seeing that, we can't keep doing what we've always done when it's not working. That's the very definition of insanity, right? So we have to do something different, and they're willing to try and look outside the box to figure out different solutions to the new problems that we are seeing. The younger generations, one kind of aspect that I've noticed that is a large misconception in a way, is a lot of the older generations feel that the younger generations are less loyal, right? And I think we've all kind of seen that, and we've had that thought process of, oh, well, they'll just jump from job to job to job. And truly, when you kind of dig down to figure out why is that, and talk to a lot of this younger generation, especially when you look at your young millennials and Gen Z, who they tend to get a bad rap. But really, that when they were growing up, they saw what their parents went through during the Great Recession of 2008, right? And the housing crisis. They're seeing what's going on in the world today when it comes to, the economy. And it's not that they're not loyal, it's that they require you to prove yourself. They require an organization to put their money where their mouth is, right? And make sure that their actions align with their words, and they're not just speaking a great game, but they're actually doing what they say they're going to do before they just hand over their loyalty. And they're not afraid to leave an organization when the culture's not right, or the organization doesn't align with their morals and what they believe or what they value. When they find that to be untrue, then they
Mhm.
will go to a different organization even if it's only $1 more, but they'll leave just to have a better culture. And I think that's what's so incredible about this younger generation. They're very conscious of their mental health, and that's something that they value. And if an organization doesn't support them in the ways that they need, including their own professional development and giving them the tools and the resources up front that they need to do their job, they do not feel bad about leaving. They don't have that kind of loyalty crisis that many of us did at least when I first got into nursing. That's a big difference I've noticed with, our baby boomer, Gen X, older millennial generation versus this younger group that's coming in.
Yeah. So I like what you did there. You're talking about this, maybe I don't want to overstate it, but say younger millennial and Gen Z, a little bit misunderstood, maybe tends to get over characterized as a particular persona, when in fact they're very open for the right leadership in the right organization to really make an impact and have a fulfilling of purpose that can be very positive. So you can't it is, I guess, talk.
Yes.
Yeah, right. Exactly. So I guess, talk about that, because that seems like maybe one of the challenges these days in the culture, that, everybody is always, 365, 24/7 looking at media. And there's all this kind of maybe reinforcement of stereotypes. I guess through your practice, maybe in trying to overcome this misunderstanding. What is it when there's new leadership coming into an organization, or an organization that's more open to embracing multi-generational intelligence? How do you look at that?
So a lot of it is just like I said earlier, it's a lack of understanding or a lack of awareness. It's not any malintent. It's just the fact that they aren't aware. They didn't know the why. And so making sure that you're including generational intelligence and embedding that into your leadership development programs is key. Is helping them and naming it out loud and helping them understand. Because a lot of leaders, they see the trends and they see the different characteristics of each generation, but they're not tying the whole picture together unless you explain it. And this is where my nerdy side really comes out. And this is the things that I love to read late at night. But if you think about something like calling somebody in to work an extra shift, right? Leaders will tell you it is like pulling teeth to get this younger generation to come in. Back when I first started 22 years ago, they would offer us double pay, triple pay, quad pay, and we'd take every single opportunity to make the extra money. The younger generation, they're much more, and the younger you get, you'll see this becoming much more of a theme, is they are very focused on the work-life balance. Money is not everything to them. And so if they find that work stresses them out, it's not a good culture, it's not a good environment, they are not going to volunteer for, I don't care how much money you throw at them, they are not going to volunteer to come in for an extra shift. And the more you bug them about it and call them, because money's not the motivation for this generation, right? It is mental health. It is being around good people, feeling comfortable in their environment, feeling valued for what they bring to the table. That is what makes them want to be there more in that environment. And so a lot of leaders, the misconception, or organizations overall, the misconception is, they're not willing to help. They're not team players. And that's not the case. It's that you're not appealing to what motivates them.
That's right.
Right? Or your culture, you might need to take a step back and ask some really, be very honest and transparent and ask those questions of those teams and say, hey, let's have a roundtable. Let's talk about it. Be honest, be transparent. I want to make this a better place. So how can I do that for you? And so one thing when I go into an organization for a consult is I ask leaders, and this is going to be in my upcoming book, there's some practical tools. One of the very initial steps is mapping out your department, right? So how many individuals do you have on your team that are baby boomers? What percent is Gen Z? And then upcoming, we're going to see, Gen Alpha coming into the mix very soon. And so it's understanding the mix of your team, not only what the category they fall into, but how do they identify? Because that's another thing people have a misconception about, is just because of the year you're born, that's how you identify. Well, I'm technically, and I think they call us geriatric millennials. Millennials is a very interesting generation because it's about to be split into two. When you start reading the most current literature out there, an 80s baby, right? Because millennial generation goes from 1980 to 2000. somebody born in the early 80s is on a different planet than somebody that was born in 1999. So I
Right.
let leaders know, like, yes, they're a millennial, but all millennials are not the same. And so when I taught Preceptor and designed my program, I always divided it out into 80s babies and 90s babies. Or what really resonates the most with them is if you remember life pre 9/11, before we ever had TSA, because a lot of them assume that we've always had security
Mm-hmm.
at airports.
Mm-hmm.
And I'm like, no, you used to be able to walk into an airport with your loved one who is getting on a plane and on a flight, go straight to the door with them, no security, no ticket, no bag checks, be able to basically get on the plane and hug them goodbye and then watch them taxi off. That was the norm. And then 9/11 happened, right? So if you have somebody that remembers life before 9/11 and remembers kind of that process before TSA, then yes, those to me are your kind of Gen X, Gen Y, that in that very beginning. Your true millennials don't remember life before 9/11. They were either too
Yeah.
young when it happened, or maybe in some cases weren't even born at that point. So it's very interesting, the dynamic, and helping leaders kind of achieve that aha moment of, oh, okay. Another thing that I talk about with them in leadership development courses or in different workshops or trainings that I've done is that we always take something. We take the things we like from our previous generation and we let go of the things that we don't like. We change the things we don't like. We see that a lot between Gen X and millennials. So Gen X parents, the reason, especially older Gen X parents were very laissez-faire, hands-off, right? They weren't at every choir concert. They didn't come to all your games because they were working. They were living to work, not working to live like the younger generations. And your millennials, your true millennial parents now, how do they parent? They're helicopter parents, right? They're always on their kids. They never let them out of their sight. They can't go run in the creek all day and come back when the street lights come on, right? So we even see it in parenting and not just in the workforce, and kind of that dynamic shift that you see because we always take something and then we always change something. So leaders that have been through any of my workshops or listened to me speak, that's one of their aha moments that I get a lot in evaluations. Is it makes sense, especially when I think about it from a parenting standpoint. I've always thought about it from a leadership lens and a
Mm-hmm.
workforce lens, when in fact, we learn the most. I think we learn the most just through our lived experiences as parents, as children, as sisters, as,
Yep.
husbands. We can learn a lot from that and then apply it to the workforce.
Yeah. Yeah. And our lived experience in other parts of our life too, maybe like our work life prior to joining, say, a big health system wasn't fulfilling, but then we find people that get really excited about being able to help people, frontline care, or whatever role it might be. Like you said, dietary, helping people get healthy, any number of roles that if it aligns with their purpose or what they see as important or their identity, that would transfer to any generation, it would seem. Yeah, that just,
And
it's,
same thing with leaders, right? You learn from good leaders and you learn from bad leaders. So
yes.
when I talk to new leaders during like a new leader orientation,
Mm-hmm.
I always ask them, what is one thing you told yourself you will never, ever do? And then what is one thing out of a leader that you have experienced in the past that you will always do because it made such an impression on you? So yes, previous leaders and their experiences with that leadership, no matter what the industry is, make a huge impact on how that leader is going to perform in the future.
Yeah, well, that even seems to go along what you mentioned about generations that want to keep the good and get rid of the things that didn't work. But you could apply that to your own career and your work experience. Is it if you had some really great leaders in your past, you're going to learn from those leaders. If you didn't have some leaders, or if you had some leaders that weren't so great, you're going to say, well, I don't want to do that. I don't want to be that leader. I want to be more like the one that inspired me to want to aim higher and do more. Yeah.
And that's one thing that's in my workshops is that, that's one of the activities we do is I have them
Mm-hmm.
take out a piece of paper, or we'll get whiteboards out depending on the environment. And I'm like, write down all the traits of a terrible leader that you've
Yes.
had in the
Yes.
past. Think of it and write it down. Then go to the other side, write down all the great traits. Now I want you to look at it, right? And really take that in, because
Mm-hmm.
the traits that everybody has the same traits, right?
Right.
Those same themes start emerging, no
Right.
matter who it is and what industry they come from. And I think you touched on a really excellent thing that more healthcare organizations specifically need to be open to, and that is transferable skills, right? Again, it kind of
Hmm.
goes back to that pipeline where we're only looking at people that have this specific background. We even see that in the job descriptions, must have this many years of experience in this particular niche, without really taking into account there are many transferable skills from no matter what industry you're coming from
Hmm.
that we should be taking note of and developing, because we can always teach skills. That's one big thing that I tell organizations. We can teach skills. We can teach somebody how to draw blood. We can teach somebody how to put in an IV, but there are certain things like empathy, right? Those soft skills, those are much harder to teach,
Yeah.
right? And so that's the things that you need to be looking for, is more of those soft skills that, and each generation has their strengths when it comes to that. And then, those transferable skills, and then worry about teaching the rest later.
Yeah. And I think that seems like a really important part of what you're talking about with retention, is that an organization that values those skills, that it values people that are able to communicate, people able to effectively be part of a high performing culture or a high performing team. Like those are the kind of things that it's beyond just the technical, right? It's all that, what it's like to communicate. So I guess with your book, I guess, this is these topics seem so dense and so broad. Like, we're obviously just scratching the surface. Is this mostly what your book is about? Is it deeper dives into all these kind of concepts, is what it takes to have systems that by design are more likely to produce the outcomes that you're describing?
Yes. So the book is titled Relational Dynamics Leadership, and it includes a model and a framework that I developed that incorporates things like communication styles, learning
Okay.
styles, generational intelligence. And so the book itself is more of a, here's what you need to know, and some things to, key takeaways, things to think about, themes that you'll start to see. But then there's a companion workbook that allows a leader, that many organizations will be incorporating into like leadership development classes for new leaders, that allows them to work through those concepts and asks them very pointed questions and things to think about. That's more of an engaging book, that a companion book that goes along with the
Okay.
actual book. And so it gives them some key topics to think about. It's kind of journal writing style, because that's what the literature has shown to be super effective when you're teaching new leaders, is to help them reflect back on certain times, reflect back on a time when, you had conflict, and how did you handle that? And here's some things that you can do differently. Here's some conflict resolution techniques that you can
Hmm.
use as a leader, because it's going to be a little bit different, right? And so that reflective learning has been shown in the literature to be extremely effective when you're teaching not just leaders by title, but as we started out this conversation, those influential people in your department, because that's what's going to drive your culture. And that it's just making sure that you are using those people of influence and you're developing them in a way that kind of, it's like, sparks that catch on, and then that fire begins burning. And then over time, it doesn't take long. We see culture as kind of this overwhelming thing, like, oh, I've got to change the culture. We can't do that. It's going to take so much time, when in fact, it's those influential people that you kind of pour yourself into, and
Yep.
they do the work for you. They
Yeah.
truly will change the culture for the better.
Yeah. Awesome. And I appreciate that enthusiasm. You certainly have a passion for your topic here, which comes through really well. So I guess when you're maybe put you on the spot a little bit here, when you think about all these generations, there probably is this, people have stereotyped them, but I guess maybe if I gave you each generation and you gave me your, like, what comes off the top of your head is how you would describe that generation. So maybe we start with boomers. Like, I'm a boomer. So how would you describe?
So they tend to be very rigid in their thought processes. They like to do things in a certain way, and they're a little bit more inflexible than the younger generations, right? They learned it a certain way, they're doing it a certain way. And on the flip side of that, they are extremely loyal and hardworking. This is the generation that didn't have so much of that work-life balance. They had that drive to work and work hard. And they also want to be recognized for the wealth of knowledge that they bring to the table. They want that to be
Recognized. Yeah. So Gen X.
Gen X. This is an interesting generation. So this is your entrepreneur generation. And if you think about it, Steve Jobs, Mark Zuckerberg, Elon Musk, all of your big giant entrepreneurs, they're all from that generation. So this tells you that they think outside the box really well, and they're not afraid to fail. They'll try something. If it doesn't work, they'll scrap it and they'll try something new. And so they have a lot of ingenuity about them, which is great for a healthcare system to have. So you want those types of people in your organization, but you need to plug them in the right way. So you want to get them onto committees. If you have a problem, go to Gen X and have them help you solve it instead of trying to do it all by yourself.
And then millennials, you talked about earlier, it's complicated.
It is complicated. So the older millennials are a lot more like Gen X. They're just kind of the newer version, or the older millennials, I should say. And they still kind of carry that trait of, focusing on work, right? And that loyalty, giving loyalty up front, right? Thank you. You gave me a job. I'm going to be loyal to you and I'll do whatever you ask. Whereas the younger millennials don't necessarily think that way. They're more, and the younger the generation, the more diverse you start seeing. They're really focused on diversity and equity and inclusion. Whereas the older generations, if you talk about boomers, up until the 1960s, the workforce was predominantly all white men, right? And the younger generations expect their organizations to be diverse, and they expect to see that, respect for diversity and inclusion and making sure that everybody is treated fairly and equally.
And then your Gen Z?
Gen Z is our tech generation. So they have never known a world without technology, which can be very frustrating when they enter the workforce. Because if you think about it, they go backwards. So this is a generation that started out with smart boards instead of chalkboards like we had in school. And then we throw them into their first job and they sit in orientation. And what do? They're watching a PowerPoint slide deck. And there's no engagement, there's no interaction, right? So this is a generation that another one of my passions is AR, VR, so incorporating virtual reality in education. It's been proven to be a super effective tool to help retain knowledge and also introduce it very quickly and help individuals gain those concepts or master those concepts very quickly. And this is a generation that needs that. They're your video gaming generation, right? So they like to learn by doing. They're very kinesthetic. Rather than, again, sitting at a desk and watching a slide deck, which like I refer to as death by PowerPoint. They're also extremely good at multitasking, which as parents can be, and as leaders, it can be very frustrating because they can be doing 3 different things at once on their phone while you're telling them something. And the assumption is they're not listening or they're not paying attention. When in fact, if you ask them, they'll tell you exactly what you just said and they completely digested it. And the studies show that giving them only one thing to do is actually less beneficial than giving them multiple things to do. So for organizations, I tell them, tap into that and harness their passions. Because if you have a stagnant coworker, no matter the generation, you start seeing the pot being stirred. You start seeing that disengagement from the organizational goals. So I always tell organizations, find their passion. Like maybe they've had, like I have a son with an immunocompromised condition and he gets IV infusions every month to support his immune system. And so infection prevention is a huge personal passion of mine because of that experience. So find whatever it is that person's passionate about and put them on those committees, right? Get them involved in professional shared governance, put them on committees because then it doesn't feel like work to them. And you're not just giving them an extra thing to do that they're going to be, disgruntled about. You're giving them something to work on that feeds their passion and their drive. So it's kind of a twofold. You're keeping them busy, right? And developing them from a professional development standpoint, but you're also, pouring into their professional engagement within the culture of the organization.
Yeah, so just maybe a little follow-up on your AR, VR kind of immersive environments. Have you used that in your leadership training? And I guess what would that look like in leadership training?
So in leadership training, it's more of a team. It's not really skills-based. It's going to be more of that team dynamic approach and taking the lead in that, no matter what the scenario is. So you could use a skills-based scenario, but you're using it in a team environment. You have multiple people have headsets on, and you can do this again. If you have a system that is across multiple states, they're working with people from all different angles and incorporating that generational. So that way you can work on things like conflict resolution, right? Or how do you lead without people getting defensive? How do you communicate effectively and efficiently in certain situations? So yes, it could be a very strong tool in leadership development, not just clinical development. So far, I haven't seen that many organizations use it specifically for that, but I think it's something that they very much should look into.
So I guess the last then, if you were going to coach Gen Alpha as to what kinds of things they should aspire to, is there just now maybe going through the education system or going to be entering the workforce? What would you tell them?
So Gen Alpha, and again, I have a child that's Gen Alpha. I lovingly refer to them as honey badgers because they do not
Mm,
care. Like they do not
mm.
care about your opinions. One of the things that one of my favorite people to follow and to learn from is Sharon McMahon from Sharon's SO. And so she has always said that your opinion or your facts don't require your opinion. And I feel like that very much embodies Gen Alpha is they don't care what you think. They want to know what is right and what is evidence-based and tell me the why, right? So you can't just say, go do this because I said so. And as a parent of Gen Alpha, I've tried that.
Yes.
It does
Yeah.
not work. You
Yeah.
pretty
Yeah.
much
Yeah.
have to completely explain the why behind it all the way back to the Constitution. So at least with my young one. So yeah, they're very in tune with, they're much more, the younger generations, I'll say Gen Z and Gen Alpha. When I was growing up as a old millennial Gen X raised, we weren't so into politics and we weren't so into history. It was just like, until I got much older into adulthood, did I really start caring about those things. And this generation, the younger millennials and younger Gen Z and Gen Alpha, they are very political and they are very into history. And again, it goes back to their drive and curiosity of knowing, why is this happening? What happened in the past that is causing this to happen? So they really connect the dots very quickly because of that natural curiosity, which again is going to take them great places. I'm excited.
Well, I really appreciate it. We're kind of wrapping up at the end of our time. So I guess, Elizabeth, how can people find you, follow you? What would you recommend?
So LinkedIn, I'm very active on LinkedIn, Elizabeth
Okay.
Jeans, and we can include my contact information. I also have a website for my consulting company if you'd like to reach out and work with me. It's my email is elizabeth@jeansstrategicconsulting.com or www.jeansstrategicconsulting.com.
Well, awesome. Well, I really appreciate your time. It's very exciting, the work you're doing. Love to have you back for a future episode because there is so much here. There's so much detail. So I'm glad at least we got to cover maybe the bigger picture and really wish you the best. And really, thanks for joining us.
Thank you for having me.
Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.